Well, do you suffer from itchy, scratchy eyes all the time? Do your eyes feel tired at the end of the day? Do you have difficulty working on the computers? Do your eyes often get kind of red? Well, they could be signs of dry eyes. You might have seen this next guy in the news. He is one of the world's most famous eye surgeons. He is here with us today in our studio to discuss new modalities and innovations in dry eye treatment today. Dr. Gulani, we are here. Thank you so much for joining us, by the way, because this is a problem actually one of my really good friends has. They have terrible dry eyes. At least that's what they think that they have, and then they assume that the symptoms they have is associated with dry eye. But since you're the expert, what does it mean to have dry eyes? What do people experience?
Sure. So let's first understand dry eyes. Excuse me. The tearing phenomena in our eye. The tears come into your eye from the tear glands, and they drain out of our eye via tear ducts, one in each lid, towards the nose, and that's how the tears leave your eye.
Okay.
So many patients actually may have no symptoms, or they get so used to it they don't realize they are suffering. Mostly female patients over 40, 45, common. Patients who've had previous LASIK surgery sometimes, they may complain about maybe tired eyes, red eyes, itchy, scratchy, sometimes to the extent of pain and irritation all day long, difficulty in wearing contact lenses for a long time. These are the most common symptoms that patients present with.
Someone was saying, my eyes water all the time. Does that mean that they have dry eyes? It sounds oxymoronic, but could that be a symptom?
Could be, because it could be reflex tearing, because tearing has different mechanisms, and if a reflex tearing, it actually responds to your irritation by producing a little more tears. So now we have actually new technology that not only can you determine dry eyes clinically, you can actually measure the dry eye by determining chemical levels in the tears in a 1-minute test.
That's incredible. Because you think it would just be, you'd be able to diagnose this just from the symptoms, but now you can take a scientific approach to it. And that was going to be my next question, is what is the treatment then for someone who has dry eyes?
So we could do, first of all, tears could be classified into 2 levels, the water layer and the oil level, even though there are other layers to it. So one is we could increase the production by using new generation eye drops that actually increase the tearing in the eye. Second, like we discussed, we could block the drainage of the tears by using a 1-minute procedure where you put in a plug into the tear duct and block the tears from going into the nose too much. 3 is you can now, with the newer technique, even increase the oil layer of the tears by unclogging the glands along our lids, which are like toothpaste tubes, which get clogged over time.
Sure.
So you can replenish a patient's water level, including the oil layer, and then decrease the outflow, like a plumbing mechanism. All of this is literally in a minute with numbing drops in the office, and you're done.
Well, and I've met people too who think, well, I just have dry eyes, it's something I just have to deal with. But it doesn't seem to be the case. You can get treatment. You're always on the cutting edge, although I hate to use that word when talking to surgeons. You're always on the cutting edge of things. But you have invented the dry eye matrix, and you teach pretty much surgeons all over the world. What is this? What is dry eye matrix all about?
I look at everything as an art, Casey, as you know, right from LASIK to cataract to dry eyes. To me, dry eye is a condition which people are suffering from, and it could be a science where we have to design the treatment to each patient uniquely. Gone are the days when doctors would just hand over a bottle of artificial tears and say, here, deal with it. No. Now you can discuss what kind of dry eyes a patient has with the newer technologies. It includes the oil layers, decrease the loss of the tears. Also look for body symptoms. Patients with arthritis, hypothyroidism, all those patients are more prone to dryness. So you look at the whole patient holistically, design a pattern, and my matrix basically guides eye surgeons on what to do in each patient individually.
And I've also liked in the past you've mentioned how if you find that a patient is suffering from 2 things, that you can bring that almost into one procedure so they can come in and have something done to help correct their vision, at the same time help with the dry eyes. I mean, it's really just an innovative kind of thing. Let me talk about LASIK surgery, because I think there's some people who are out there who have had LASIKs are concerned that that will lead to dry eyes. Does that seem to be the case? Do you see that?
In our previous discussion, for example, if you do cookie cutter LASIK on everybody, not looking at their preoperative evaluation, doing a detailed dry eye testing with the technology that we just discussed we have, you may prone to it because with LASIK you cut a flap and that decreases the innervation or sensation, which does recover over 6 to 8 weeks. But you rather modify the technique. So dry eye patients today can be corrected with their dry eyes and have a modified LASIK technique where you do not cut or use any blades. So it can be done, yes.
That is pretty incredible. And so do dry eye patients, though, if you do find that you're suffering from that, you can still have LASIK surgery, or if you have a cataract, you can still have that done in pretty much one centralized location?
Yes, of course, getting it treated first and then modifying your technique, yes.
Okay, and you're always involved with new technologies. Kind of tell me what you have been up to, and you are either getting ready to or have come back from Europe, correct? Is that right? You're leaving for. Yes. And so you're going over there, I'm just curious, to go over and work with eye doctors overseas.
Yes, and teach at some international meetings, all these concepts, share with them. And I also learn a lot when I'm with my colleagues there. So dry eye is very exciting because now it has become a science. Patients don't have to suffer anymore. We can diagnose them with dry eyes much more earlier, decide the kind of dry eye they have, tailor the treatment to it, and relieve them of this, what we call, really lifestyle affecting symptom.
Yeah, because I know it can be not only annoying, but it can also be debilitating in some instances. If you're trying to drive down the road and your eyes are itching or they're just watering, you can do something about it. So, Dr. Gulani, thank you so much as always, sir, for being here. We appreciate it.